Dentistry, transforming your health for a lifetime.
We're here with Dr. Mike Rogers from Complete Health Dentistry of Northeastern Pennsylvania. Dr. Rogers, since this is Stroke Awareness Month, can you give us a little background on what is a stroke?
Well, a stroke is when one of the blood vessels or blood vessel that feeds the brain blood and oxygen becomes blocked or clogged with a blood clot. And what that does is it limits blood to the area, oxygen to the brain, and it could start to cause depression, breakdown of the brain, death of the brain cells, and also just can start causing motor and other functional issues.
That sounds scary.
It is. It is.
So what are some of the risk factors?
Well, there's quite a few risk factors. Some of the ones that are more prevalent are high blood pressure, diabetes, heart disease, smoking. Diet plays a big part in it. A previous stroke or TIA.
What's
obesity.
TIA?
TIA is a transient ischemic attack, and what that is it's mini stroke, and most times that's completely reversible. So some people may ignore it, others think, okay, I had it, and it's in the past, it's history, and so that's not going to affect me anymore. Obesity, sleep issues. I know we've talked in the past about other things with sleep, and we will be getting more into sleep and how that plays a part. But sleep issues can certainly increase your risk for stroke.
So that's one of the reasons why you check for sleep issues in our office.
Yes, we screen every new patient for sleep issues. Just does create such a wide variance of medical issues. And we do a lot of screening, blood pressure screening, and sleep issue screening in our office.
Are there any other risk factors?
Well, we've talked about it in the past, too, that bacteria in our mouth, there's studies coming more and more out of medical studies that indicate people who have strokes, they seem to have a more elevated risk of periodontal or gum disease, more dental infections, more dental problems. It's hard to say, is that a one-to-one relationship? Is it? So more studies are being done right now showing, are you more prone to stroke and things like that from having bad problems in your mouth?
Okay. What if I have these risk factors? What if I do smoke? What if I have periodontal disease? Or if I've had a TIA or the other things that you mentioned?
Well, seeing a physician on a regular basis is always your best advice. You need to have someone you trust. You need to have someone that's going to be looking for it, especially if you do have these risk factors. Also, you should be seen by a physician on a regular basis, one to take care of your any medical concerns. Don't wait until something shows up. Stop smoking. Both medicine and dentistry all advocate that. Limit the amount of alcohol that you intake. Illicit drugs you should eliminate as well. Watching your diet, because more and more studies right now, there's actually a 44% increase in stroke accounts in the population of age 25 to 44. And what studies there too are showing that it starts in childhood with our kids having a lower beneficial diet, more supersized meals of these diets, and an increase in not exercising, not getting out and doing stuff. So
the age of electronics.
The age of electronics, exactly. So all of this stuff is starting at a younger age, and we're starting to see more and more young people having strokes that we never had, that was always looked at from, as an older person's problem, but now we're starting to see an elevation in that.
So you're saying strokes are no longer age-related as far as in the elderly?
It's not just an elderly issue anymore. It's starting to show up more because of how we're being raised as children.
So more sedentary lifestyle?
Exactly.
Okay, well, what if someone near me or even myself, what if I think I'm having a stroke or someone that's near me? What do I do?
Well, they've got an acronym for, how to spot a stroke, how to look for a stroke. I mean, the term they've updated it to is be fast. It used to just be fast, but now it's be fast. And B stands for balance. If you start to lose your balance more frequently, you're not able to stand.
This acronym means things that I'm looking for.
Exactly.
Okay.
Things that you're looking for. So balance would be the first one. Eyesight changes. You could lose eyesight in one eye or both eyes, and it may come back or it may not. But if you have eyesight disturbances, both of these first two come from the back, a stroke or a blood clot in the back part of the brain. And because of that, what happens, that's why they changed it, because we were missing these people.
Okay.
And so now these extra pieces add to, we can evaluate now quickly 95% of the population that is having a stroke. And then the rest would be the fast part. F stands for facial drooping. One side may droop. Arm weaknesses is the A. If you've got a one-sided arm weakness, that just is unusual. The S stands for speech difficulty. If you start to slur your words or not making sense so much with it. And then the T is, as quickly as you can or someone around you, call 911. Getting you into the system, having someone come and help you as quickly as you can is the best way to prevent damage to the brain, because time is of the essence when it comes to a stroke.
So T stands for time?
Time, exactly.
Okay. So I know you touched a little bit on periodontal issues and that they're found in stroke. How exactly does a stroke relate to the mouth?
Well, great question. What it is more and more inflammatory problems are being related back to the mouth. If we look at, we've got bacteria in our mouth, our body is fighting this bacteria that leaches into our bloodstream 24 hours a day, 7 days a week. It's a constant barrage to our immune system. That increases our systemic inflammation, meaning our inflammation in our bloodstream. When we start to escalate that bloodstream inflammation, our body's response is to add cholesterol to the system to minimize it. And once we do that, once our bodies do that automatically, that starts this whole inflammatory cascade of problems that can arise. Taking care of the mouth starts to eliminate our body's response working here, and it gives our body a better effect or a better ability to work on other things it needs to and not just focus on the mouth.
That makes sense. So, Dr. Rogers, what final words do you have on stroke prevention?
Stroke prevention is one, exercise. Exercise, watch your diet, control your blood pressure, control your diabetes. Don't be an ostrich, stick your head in the sand and just say, oh, you know what, I'll get to it when it shows up. I'll address it afterwards. Be proactive in your health.
Okay. Thank you for joining us. For more information on insurance and many of the procedures performed at our office, please call 253-5000 or visit our website at CompleteHealthDentistryofNEPA.com.
Hi, this is April from Complete Health Dentistry. Did you know dental insurance was created back in 1954 with $1,000 a year maximum? Sound familiar? That's because those maximums are still in effect today, 60 years later. While inflation increased, dental coverage has not. Although you may be tempted to make decisions about your dental care based on insurance, remember that your health is the most important thing. At Complete Health Dentistry, we do everything we can to help maximize your insurance and minimize reduce your out-of-pocket expenses. We are pleased to announce that we now participate in several insurance plans provided by local businesses. We welcome employees of Woodlock, Wayne Memorial Hospital, Suburban Propane, FedEx, Lowe's, and St. Mary's Villa. Call 253-5000 and schedule your new patient experience today.
Complete Health Dentistry. Transforming your health for a lifetime.
Hi, I'm April from Complete Health Dentistry of Northeastern Pennsylvania. I'm here today with Joyce, our insurance coordinator. How are you today, Joyce?
I'm doing awesome. We actually started our day off today with a yoga class at our office.
Wow.
I know. Dr. Rogers is so passionate about complete health and well-being that he allows us to come in early on the first Wednesday of every month to do a yoga class. Well, he attends the Greater Honesdale Partnership Board meeting.
That's awesome, Joyce.
I know. We're very grateful that he's doing that for us.
And how has that helped you?
Well, actually, I have trouble with my knee, and it helps loosen things up and build my strength, and it actually helps me focus. So it's really great for me. Thank you.
So I invited you today to join us to help clear up some insurance myths and explain to our listeners, why doesn't my insurance pay for this?
Well, that's a question I hear almost every day.
Okay. Well, I first wanted to start with the history of dental insurance. Can you give us a background on when dental insurance began and what the benefits were then compared to now?
Sure. Actually, insurance was started back in the 1950s, and at that time, the yearly maximum was $1,000.
Wow, $1,000 in the 1950s? That
Yeah.
was a lot of money. You could do your whole mouth with that.
Back then it was, but unfortunately, it's pretty much the same today, and it's 60 years later.
You mean it's still $1,000 a year?
For most plans, it is. While inflation increased, dental coverage has not.
Oh, that's awful. So what do you think is the highest maximum you've recently seen? Is it just 1,000 or are there any that are more than 1,000?
No, there are some. I've actually seen one with 3,000, but most plans run between 1 and 2,000.
Okay. Well, what do you recommend? What recommendations do you have for patients with dental insurance?
Well, it's really important to know that dental insurance is not like your medical insurance.
No?
No, not at all. Most of us have medical insurance that covers all of our treatment except for a copay, where dental insurance is more like a scholarship. It just helps defray the cost of dental treatment.
Oh. And with $1,000 a year max, that's not going to cover much, is it?
No, not at all, but it does help a lot, make it easier to get the dental care you need.
Okay.
And it's really important that everybody understands that most dental benefits don't cover all the procedures. So we want to make sure that when you decide on your treatment, that dental insurance is not the only thing you consider.
Okay. Well, what should be considered?
Well, you should consider what's best for you. And you can decide that when you meet with Dr. Rogers, and he'll discuss all your options and the benefits of each option. And then only after you're thoroughly educated, at that point, then you can make a decision on what you need to do.
Okay, that makes sense. Well, how is dental coverage determined?
Well, strangely enough, it's not determined by your dentist at all.
You're kidding. So Dr. Rogers has nothing at all to do with how dental coverage is determined?
No, your employer, or the patient's employer, and the insurance company agree on the amount your plan pays and what procedures are covered. It's not based on what you need or what your dentist recommends. It's based on how much your employer pays into the plan. Sometimes you may have a dental need that's not covered at all. And employers choose generally to cover some, but not all of the employee's dental costs.
Okay.
And my goal is to allow Dr. Rogers to focus on the dentistry. I'll take care of the insurance. And
you do a great job at that, Joyce.
well, thank you. And Dr. Rogers' primary goal is to help you maintain good dental health, but not every procedure he recommends will be covered.
So how would you help then if the procedure's not covered?
Well, I'm the insurance coordinator, and my job is to make sure that there are no surprises on your bill. I'm going to research your benefits, and then I'll be able to help you to know your deductibles, what your maximum is, and what services are covered, and even if we participate with your plan.
What do you mean by participate with our plan?
Well, dental practices are contracted with select insurance companies, and not all insurance companies are the same. Many insurance companies only cover basic procedures.
Okay.
Dr. Rogers has to be very selective in who he participates with because he does all procedures under one roof right here in the office and must select the insurance companies that cover most of those services. And then that makes my job easier to maximize your benefits, and I can also minimize your out-of-pocket expense.
Okay. What's the biggest frustration you have ever had dealing with insurance?
Well, I don't like the way the insurance companies dictate what type of treatment's allowed to be done for the patient. For example, if you need a filling on a back molar tooth, we do white composite fillings, and the insurance companies only allow for mercury silver fillings in that tooth.
You're kidding. We don't even do mercury fillings in our office.
Nope, and we haven't done them for probably almost 20 years now, but that's really all the insurance company allows in most cases.
So then they don't pay for a white filling at all?
No, they'll just allow the amount for the silver filling, and then
So by allow you, they pay what they would pay for a mercury filling?
yes,
Okay.
yes,
Okay.
and that's it. Another example is if you're missing a tooth. Dr. Rogers is going to recommend the best treatment for you, which is to replace that with either an implant or a bridge. And the insurance companies might only recommend that you have a partial.
You mean like a denture?
Yeah, removable partial denture. Sometimes that's all they cover.
Huh.
So it's really not what's in your best interest. It's just what is, I guess, the best option for the insurance company.
Okay. Well, as our insurance coordinator, can you explain to our listeners what you do for them to make sure they're getting the most out of their dental benefits?
Sure. I always submit all the paperwork, even if we don't participate with your insurance. I'm going to make sure that we maximize your insurance. And even when you come, I'm going to check all the benefits that you have. So in advance, you know what you're going to have to pay. You'll know what your copay is.
Oh, that's very helpful.
Yeah, we'll let you know what's covered, what's not covered. And then we can also offer you some interest-free financing to help fit all your treatment and your lifestyle. And this is especially good for patients that have insurance that we don't participate with, because this interest-free financing allows them to pay the bill at our office. And then when they do get their reimbursement check, they can just simply directly apply it to the loan.
Okay, so their insurance check usually comes in before they even get their first bill for that loan, correct?
It usually does, yes.
Okay, that's great.
It just makes it really easy.
Wow, Joyce, you really know your insurance stuff. I'm so glad you're part of our team.
Well, thank you.
When we come back, we will discuss insurance terms and help you understand how insurance companies share treatment costs with you, the patient. I also can't wait to share some very exciting news about insurance in our office. Stay tuned.
The days are getting longer, the snow is finally melting, and now it's time for a good spring cleaning. At Complete Health Dentistry of Northeastern PA, Dr. Rogers reminds you that a professional dental cleaning is imperative to your overall health. Did you know that 8 out of 10 people have gum disease? 50% of all heart attacks are linked to gum disease, as well as stroke, diabetes, Alzheimer's, pancreatic cancer, arthritis, and pregnancy complications. At Complete Health Dentistry, you will receive many life-saving screenings to keep you in tip-top shape and decrease these potential medical complications. We want our patients to enjoy a long, healthy life with minimal medical issues. Regular dental visits will help you maintain healthy teeth and gums and help prevent serious health conditions. Take time for your health. Call 253-5000 and schedule your spring cleaning today.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back. This is April from Complete Health Dentistry of Northeastern Pennsylvania. And again, joining me today to help clear up dental insurance myths for our listeners is our insurance coordinator, Joyce. Welcome back, Joyce.
Hi, April.
Hey, did you know where the see your dentist 2 times a year came from?
Actually, I don't, April.
Where it actually came from, interestingly enough, is from an ad for Pepsodent toothpaste many years ago, from the 60s.
Wow.
At that point in time, people might have been brushing their teeth regularly, but they were not in the habit of getting to their dentist. And with that, the result was that people's teeth were in pretty bad shape before the advice to schedule twice a year dental exams came along. It was actually a marketing ploy. It was not anything invented by a dentist.
Oh, that must be why our grandparents and people older than them had dentures.
Yeah, my parents did.
I guess I'm lucky mine didn't.
So, Joyce, would you mind explaining to our listeners how dental plans share treatment costs with them?
Sure. Most insurance plans have a deductible. And
What's a deductible?
a deductible a deductible is the amount of money that you must pay before the benefit starts to kick in and pay for any services that you do. And sometimes it takes a couple of services before you can meet your deductible. So most plans don't require a deductible for preventative like cleaning or anything diagnostic like an exam or even x-rays.
Oh, well, that's good. What's a typical deductible? That's a tough word today. What is a typical deductible?
Most plans, it's $50 a person, and if you have a family, it's $150 for the family.
Okay.
So as long as it's met, then you won't
And
have
that's
any.
just once a year.
Once a year, yes, it
Okay.
renews each year.
Okay.
And there's also co-insurances. So in most cases, after you meet your deductible, then you're going to be expected to pay a percentage of the benefit. So for instance, usually preventative is 100%,
And preventative would be cleanings.
cleanings and x-rays and exams.
Okay.
And then they have basic restorative, which would be for fillings and root canals.
Okay.
And that's usually covered at 80%. And then they have major services, which would be for crowns and bridges and things like that. And that would be basically at 50%.
Okay. So then your insurance would pay 50% for that, and then you would have to, out of your pocket, pay 50.
Yes.
I
yes.
get it. Okay.
And then we have maximums per year. And that's the most that the insurance company will pay for the year for your benefit. And most of them run for a calendar year from January to December. And any cost you have after that would be out of pocket for you.
So that's what we talked about in the beginning. That started in the 50s. That was 1,000, and now
Yes.
it's still 1,000. Okay.
Yes.
Okay.
So when you reach that limit, then it's out of pocket expense.
Okay.
And a lot of insurances also have pre-existing conditions. So if you had a tooth extracted before you got on the plan, they might consider that as pre-existing and not cover for you to have tooth replacement.
Oh.
So sometimes that then becomes a non-covered service at that point.
Okay.
And I'm sure you would like to know what a non-covered service is.
I certainly would.
That's something that your insurance company will not cover. It's pretty clear.
Self-explanatory.
Yes, it is.
Okay. So that's definitely out of pocket.
Absolutely. Another term that people have questions about is coordination of benefits. So if you're,
What does that mean?
that means if you're fortunate enough to have two dental plans.
How do you have two dental plans, Joyce?
Well, if you have a husband and a wife and they each have insurance, you can cover each other on the other plan.
Oh, that makes sense.
Yes. But the benefits on those plans shouldn't add up to more than the total charges.
Okay.
So they coordinate them together.
So the insurance companies will make sure that one doesn't pay more and the other one pays the same one so that you're making money on that.
Exactly.
Got it.
They want to make sure that you don't get paid any more than what you've paid into the services.
Okay. And so when you have two insurances, does that guarantee then that all of your work would be covered?
No, sometimes it's sad, but sometimes services are not covered on either plan.
Oh, okay.
So
So
it's
sometimes it could be a false sense of security having two plans.
absolutely.
Okay.
Absolutely. Again, it's just what the employer and the insurance company agree on that would be covered.
Back to that contract between them. I
Yes,
see.
yes.
Okay.
And most insurance plans have frequency limitations.
What does that mean?
That just means, say, for a cleaning, they might only cover 2 cleanings a year, and you might be required to have more than that if your gums aren't healthy. But that's the limitations of the plan.
So what should I do? Because I know Dr. Rogers is very focused on overall health, and there's a lot of times that he recommends that patients come in every 3 months, not 6 months. So that's 4 times a year. What if my insurance only covers 2?
Well, it's still recommended that you have those 4 cleanings a year, but just keep in mind that 2 of those visits will just be for the cleaning, and you won't have any x-rays or exams with that. So it's going to be a minimal charge.
So the one that's out of pocket is just strictly the cleaning.
Yes.
Okay.
Yes.
So I shouldn't just say my insurance won't cover that, I'm not coming in. Because
Correct.
That's not in my best interest for my overall health.
Correct.
Got it.
And then there are things that an insurance plan may say are not dentally necessary. Well, that's just your insurance carrier saying that it's not covered, and it doesn't mean that treatment wasn't needed and it's not in your best interest. It just means that the insurance company is dictating what they feel is necessary. And really, we should leave that up to you and Dr. Rogers to make that decision. Even if your insurance denies it, we can always appeal it for you.
Okay, and you're great at helping them with that.
Absolutely. We will take care of that in all cases.
Great. So do you have anything else that you'd like to add to help our listeners better understand why my insurance doesn't pay for this?
Well, yeah, back to that question. It's important that, insurance companies are in the business of making money. So just keep in mind that Dr. Rogers spends a lot of quality time and his expertise with you to determine what's best for you. So your insurance company is not always looking out for you and the best procedure for you. They're just looking to see how they can save money, and they don't have your best interest in mind.
Wow, that's surprising.
It is, but it's just something that's the way insurance companies work.
Okay. Thank you, Joyce.
Thank you.
I just wanted to add, Dr. Rogers asked me to add his tips to keep your dental costs to a minimum. So knowing that things are not always covered with your insurance, we want to keep your costs to a minimum. So the first thing that he recommends is to make sure that you're brushing your teeth twice a day minimally with a fluoride toothpaste. He also wants to make sure that you're cleaning between your teeth. And yes, that means floss, and floss daily. You should eat a healthy diet that limits sugary beverages and snacks. And you should see Dr. Rogers regularly for prevention and treatment of oral disease. And always be proactive. Take care of dental problems when they are small so they don't grow up to be something big. And now I want to share some very exciting news with our listeners. We are so pleased to announce that we now participate in several insurance plans provided by local businesses.
We now welcome employees of Woodlock, Way Memorial Hospital, Honesdale National Bank, Suburban Propane, FedEx, Lowe's, and St. Mary's Villa. If you're not sure if we work with your insurance plan, just give us a call at 253-5000.
And schedule your new patient experience today, and you'll visit with Joyce to get through all of your insurance needs and questions. For more information on insurance and many of the procedures performed at our office, please visit our website at www.completehealthdentistryofnepa.com.
Did you know dental insurance was created back in 1954 with $1,000 a year maximum? Sound familiar? That's because those maximums are still in effect today. Although you may be tempted to make decisions about your dental care based on insurance, remember that your health is the most important thing. At Complete Health Dentistry, we do everything we can to help maximize your insurance and minimize your out-of-pocket expenses. We now participate in several insurance plans provided by local businesses. We welcome employees of Woodlock, Way Memorial Hospital, Suburban Propane, FedEx, Lowe's, and St. Mary's Villa. Call 253-5000 and schedule your new patient experience today.
Clean Health Dentistry, transforming your health for a lifetime.
You've been listening to Complete Health with Dr. Mike Rogers, where we are transforming your health for a lifetime. For more information on this topic and many others, tune in every Saturday morning at 8 a.m. If you missed a show or want to re-listen, go to our website at completehealthdentistryofnepa.com for a link to listen to all of our shows. You can also like our Facebook page, at Complete Health Dentistry of NEPA for more information on these topics.